Good morning, Professor Guo. Welcome to the podcast. It's a pleasure to have you here today. It's good morning from the UK, and it's the afternoon, I believe, in China.
Yeah, it's my pleasure to talk with you.
So, Professor Guo, I'd like you to just talk a bit about your background and how you got into the world of Microtia.
I work in the field of plastic surgery over 40 years. I began a resident training as a plastic surgeon when I was 20 years old. So now more than 40 years passed. In the beginning, I'm the general plastic surgeon. I do all kind of plastic surgery. And late, because in China we had a main Microtia patients, that surgery is a real challenge for the surgeon. So I spend more and more time on the ear reconstruction. So nowadays, I'm just spend my 95% of time to do the ear reconstruction.
And to date, how many surgeries have you done for Microtia patients?
Today we have 8 patients. So today I just finished my surgery. Every day I spend like 6 to 7 hours in OR to do a ear reconstruction. For my procedure, we usually have the two surgery. The first stage surgery, we just lasted like less than 30 minutes, and the second stage surgery lasted 1.5 hours. So every year I have over 1,000 ear reconstructed. So
1,000.
1,000, more than 1,000. So about 2,000 to 3,000 surgery totally I done a year.
So I have here that you have performed over 8,000 surgeries. Is that correct?
Yes, totally.
That's a lot.
Yeah, it's a lot. Maybe I'm the one that have the biggest number for the Microtia surgery in the world.
You are the pioneer.
Yeah, I'm not a real pioneer. Pioneers a lot of Dr. Brent in America, Dr. Gillis in England, 1920. He did the first ear reconstruction in London. More than 100 years ago. But I'm the pioneer to do the ear reconstruction with tissue expansion. That's a new technique.
And what does that technique involve?
Traditional techniques, we use the skin graft because when you do the ear reconstruction, you need the framework. So we have the good shape. And also you need the coverage, skin coverage. Traditional technique, you use the skin graft to cover especially the back of the ear and also the end of the ear. In the front part, usually the skin flap, But with tissue expansion technique, we created the new skin or grow the new skin with the tissue expansion technique. So we carve the whole framework, front part and the back part, totally with expanded skin. This skin's color and texture is much better than skin graft. So that's why now very popular here in China.
And so do you use the rib cartilage? Where they take the rib and they make the shape of the ear?
Yes, we have the two kind of material to have the framework. One is the cartilage. Now majority of the ear reconstruction, did in the whole world was done with the cartilage, but some doctors still use the policy. Policy is the one kind of plastic, and that framework is the prosthesis. So use the prosthesis also can have the ear, but it's a foreign body, foreign material.
How long does the process take in terms of surgery time?
For my surgery, we have 2 types. First time we put tissue expander and the skin over here. It take me less than 30 minutes.
Wow.
yeah, sometimes just about 10 or 15 minutes, that's enough. We make incision and dissect and then put tissue expander into it and surgeon wound. That's it. But then for the second stage of surgery, we halve the cartilage, we made a framework, and we remove the tissue expander, and we thin the skin flap, and then we suture together. And that takes me 1.5 hours.
So, for the statistics in the UK, Microtia is 1 in every 6,000, and in the US, it's 1 in 10,000. What is it in China?
Yeah, the Chinese have a high rate of accident for the Microtia. Caucasians is less patients, but in China now we totally have 400,000 patients in China. We have 1.4 billion Chinese. So every we have three Microtia here every 10,000. Every 10,000 newborn baby, we have 3 patients.
Wow, 3 in 10,000.
Yeah,
That's significantly higher.
yeah. Highest should be in Latin America. Latin America, they have like 17 patients in 10,000.
Oh, I didn't know that. That's interesting.
Yeah.
And when you do the reconstructive surgery, do you have some patients that they can have the hole where you drill a hole so that they can have the hearing as well? Or
Yeah, it depends. That surgery now not very popular. In that surgery take have the more than 100 years. In the early stage, doctor try to drink a hole. Make the air can trans into the in the part of ear. But nowadays we found that the function is not very good. So more and more doctors and the patients choose use the device, like a BAHA and a Bonebridge to increase the listenability.
when parents of children with microtia, when they come to see you, what would you say their main concern is?
I've seen a lot of these kind of patients. Yesterday morning, I had 98 patients come to see me. Some mama just cry. They
Mm.
don't know what will happen. They are worried about the listenability. They worry about the surgery. It's good. How long it take? A lot of bleeding, or it's a pain, and how about the final result, and they also worry about the future. They can find a job or not, and they can get married or not. Those kind of things. I explain to them all the detail of what I know, because I treat a lot of patients. I know many of my patients after surgery, after they grow up, they can find a job, they can get married, they have family, they can enjoy life. So after I told those stories, mama feel much better.
And do you think there's a difference in culture, say, for example, in China versus in the West?
Yes, because I worked in America for 2 years, in the 1995 to 1997. I know there are differences between the West culture and the Chinese culture. In Chinese culture, one of our baby have the congenital deformity, not only like Microtia, also clip lip or clip palate. Those kind of deformity, when other patients or other people meet them, they stay on them, and someone even say something not good to them, so they feel not good. But I know I noticed in America, people tend to pretend to not notice it. Even they found they have the problem of ear, but they not ask most of the chance they don't ask the question. So in China, they have more pressure here in China.
Why do you think that is?
Yeah, so that's but if it's for the mama, they're worried a lot, compared with the Western country, and also our kids, if they have they really feel not good, not self confidence when they go to the kindergarten, when they go to school, they don't, someone don't like play with their, friends, people treating them not very friendly. That's some kind of discrimination. So that's the problem we have to face. But that's a culture.
Here we focus on self-acceptance.
Mm.
So in the UK especially, some families decide to have the corrective surgery when the child is young, and then in some instances children wait until they're an adult and then they make that decision themselves. How would you say it is in China with that? Would you say that you treat a lot of children? Do you treat a lot of adults as well? What's the ratio?
Children, they really want to have the new year, but they're afraid of the pain, so they dare not to come to see the doctor and have the surgery. But when they get like 11 or 12 years old, they they pay attention to the, if the boy pay attention to the girl or the girl pay attention to the lady, boy, that's the time, they have the pressure. They want to come to see the doctor. But then, best time for me to do a year reconstruction. I mean, if we want to have the best result, usually it's between 7 to 11 years old. In this age, the cartilage quality is very good to cow and have very good result. If they get old, skin becomes thinner and the cartilage becomes strong and hard, not easy to cow. So the best time should be between 7 to 11 years old.
7 to 11.
Yes.
And do you offer the patients emotional support as well?
Of course, that's as a doctor, we not only treat them, physically, but also psychologically. The mom need help, and the dad need help, and the children need help. We try our best. Sometimes if mama have the newborn baby, they always, feel guilty. They thought something they have done wrong. They, blame themselves. We told them that why you have such a baby, and all when the children grow up, someone, not treat them very friendly. I told them, one day I can have the year for you. You will become the normal, and they feel happy. They just wait. If they have enough cartilage, they come see me, and I have to fix them for them. They feel happy. They feel really happy about it.
And do you treat international patients?
Yeah, some of my patients come from the United States, Europe, and tomorrow someone come from the Iran, and so also from the Asia, like Malaysia, all of the world. But most of patients still come from the China. China is a big country with a lot of patients. They keep me very busy.
And how would you say that your technique is different to, say, the rest of the world? What makes your technique unique?
Yeah, most of the doctors, American doctors, European doctors, and some of the Japanese doctors, and some of the Chinese doctors, they still use the traditional technique. That's with that technique, in the first stage, they just have the cartilage and make the framework and put under the skin, and like 6 months later, that elevated the ear and the skin graft on the back of the ear. At the same time, they transfer we call it fascia flap, the cartilage and the skin graft on the fascia flap. That's a really traditional technique. I have more than 100 years, and a lot of doctors still use that technique. Maybe still most popular technique used in the whole world.
What's your view on Medpor?
Medpor is useful. And, I began learning to use the Medpor in 1995 in the Children's Hospital, Los Angeles. Dr. Ranish is my tutor.
He came on the podcast.
I spent some time with him. I learned from him. I know I can do that. And also, when I come back to China, I do use the Medpor to do a ear reconstruction for some of the patients. But later, I find complication is high, much high compared with the cartilage. And also because with that technique, we use the temporal fascia flap and with skin graft. For Chinese, if you have skin graft, usually we have the hyperpigmentation. And we either have the scar, we call the high traffic scar. So result is not as good as with cartilage. So that's why that becomes less and less popular. Now in China, maybe 3% of the patients still use the Medpor. Most of the patients still, usually parents, they learn, all the knowledge. They make decision, what kind of materials we should use for their children. And now 97% of the patients, they choose use the cartilage. So Medpor become less and less popular here in China.
And would you say Medpor has become less popular in China just because it's not as successful?
With this prosthesis framework, you cover that with skin. Should be very thin. If not thin, contour is not good. But if thin, and it's easy to broken. If they're broken or have infection, we have to take it out, so totally fail. So that's the main reason. Long-term result is not good. The main reason for doctors and the patient don't like it.
So with the rib cartilage reconstructive surgery, it's 2 stages, and once they're completed, do you then see the patients after the surgery?
No, most of the patients just go home. They go to school. This first stage surgery, they just stay in the hospital for 4 days. And then they go home and they can go to school. Every day, the parents inject 1 or 2 cc normal saline into the tissue expander. Not to puncture the skin, but puncture the injector part. So they can, no pain. Very, very safe and very easy to handle. And then after 3 months, they come back and then I do the second stage surgery. They stay at the hospital for 6 days. Then go home. They remove the sutures at the local hospital. Usually 1 week after, go home, they can go to school. So, in China, our parents pay a lot of attention to the education of the kids. They want the kids, not stop the study in the school. They want to go to school. So we try our best, not let them spend a lot of time in the hospital. In the early stage, the injector part is buried inside of the skin. You have to puncture through skin, injected through skin. In that time, you have to stay in the hospital, or stay in the hotel close to the hospital, that the doctor and nurse inject the normal saline. Nowadays, inject part is put outside the skin, so mom can inject it very easy. Maybe I can show you later. One of the patients here.
Do you want to show me? I'd love that. Please. We're getting a nice lesson from Professor Guo. Oh, look. Hello.
This young man comes from the Taipei. From Taipei. We put the tissue expander over here. This morning. So
this is this morning.
This morning, and after surgery. So this boy or girl? This boy, this is the injector part over here.
Okay.
And his mom inject the normal saline here 1, or 2 cc every day. So the skin grow.
But how does the skin grow?
Like mama have the baby, when the baby grow, the abdominal skin grow. Like we have the tumor on the skin. If their tumor grow, the skin, we have more and more skin. It's quite similar. And this boy and girl.
What's his name?
What's your name? 叫什么名字？朱红瑞。Do you have English name? 英语名字有没有？No. 这是个 girl。
Hello.
This girl, 几天了？
是不第一天，昨天。
昨天的 2 days, it's yesterday I performed surgery for this baby. Now I have a little bit swelling and the color
Okay.
is not good. But the one she come out from the OR, the contour is very clean and mama very happy. Now the swelling, maybe wait 1 or 2 months. We
Okay.
have the very good shape of the ear here.
And so this technique that the children have, this is using rib cartilage.
Mm-hmm. Yeah, just take the rib cartilage.
And so how long?
Not very pain.
They're so happy.
Oh, they're happy. They're really happy.
Can you ask them if they're in any pain?
疼不疼？那个外国阿姨问你们疼不疼？你做的时候疼不疼？ She said no pain. We injected some local anesthesia here.
Yeah.
So that lasts for 72 hours. So not totally not pain. After surgery, this young man is just this morning we have surgery. 对吧？你几个小时了？
Can I see?
手术几个小时了？我说现在多长时间了？做完？ 3 hours after surgery.
This is 3 hours after surgery.
Yeah, this young man. 你还能看到？你过来往这边看。到我这，都过来。This young man after surgery just for 3 hours. I asked him pain or not. He said not pain.
But the gentleman, did he have which surgery are you doing on him?
It's first stage of surgery. We put the tissue expander over here. We make the incision here just 2 centimeters and dissect and mine his area. We put tissue expander into it. This is the injector part. So that lasts maybe 30 minutes. And this boy, come on, 我不快。After inflation, for 你多久了？3个多月了 ，more than 3 months. And every day his mom injected the normal saline here into here and flew into the pocket, the silicone bag. We call the tissue expander. They become big, and the skin of over it grew. So we have the skin. So
And then what do you do when it's that big? Does it go back down?
Yeah, it's a big ball, but it's okay, no problem. He still can go to school, no problem. And then play with his classmates, This boy, after surgery, we have the ear reconstruction yesterday. We harvest the cartilage and made the framework. We take out the tissue expander and put the framework into it. And then we have the suction drain, here.
Okay.
So he has ear. A little bit of swelling and redness, but to take, just 1 or 2 months, he will have very good ear here.
Can you tell them I have Microtia as well?
这个阿姨她也是小儿畸形，她也和你们一样的病。Yeah, that's good. Result is good.
Well, I wish them all of the success in recovering and sending them all my love. And Professor Guo, if a parent, they came to see you and they have a child who has Microtia, what would you say to them? What advice would you give them?
I told them that's not a big deal. Usually parents really worry about the listenability. That's the first. And also they worry about, late stage of surgery. It's pain, or how if it's okay for the baby when they grow up to easy to find a job and find a girlfriend or boyfriend, something like that. And also mama really worry about they feel good. They want to know what happened, why I have such kind of baby. If I have the second one, third one, I still can have that kind of problem. I have to explain to them all the detail about the knowledge. I have the slides. Every Monday morning is the time for me seeing the patient. Usually, like 50 to 500 patients come to see me. So I give lecture to them. I give lecture for 1.5 hours and go
Yeah.
tell them all the detail. If you like, sometimes I can show you. I can give lecture to your patient. If you have the friends, I told how we know, our knowledge about why we have such kind of disease, what a patient will face in the future, and what kind of surgery we can do, what's the final result, all these kind of things. Because mom have to wait at least 7 years to do the surgery. We tried 6 or even 5 years old to do the surgery, but the results is not good. So nowadays, I just do after 7 years old. So it's a long time for mom to wait. When I 10 or 20 years ago, I still do a lot of cliff lip and the cliff palate. I just do, in 3 months, sometimes 3 days after baby was born. So, but for this surgery, we have to wait for 7 years. So mama is feel very badly about that. They really worry about the final result, and even can his child have the share, have the normal life. I told them because I have a lot of patients. I know someone get married, some get rich, some get promoted as some officer, some work as a scientist, some work in the computer. I told a lot of my patients now have job, they can enjoy the life, they can get married, they have a baby. So those kind of things were helpful for them.
A lot of parents, mothers, they blame themselves. They feel guilty, like you said.
Yeah.
And they worry, did I do something wrong? Could I have done something to prevent this? What would you say in your experience? How would you answer that question?
Usually we told them maybe something wrong with the air pollution. That's why we have the environment protection. That's really a problem. Some chemicals, some radiations, even some, of course, sometimes some drugs, some virus. I told them, in China, we have the more patients in the city compared with the countryside. We have more patients in the coastal area, industrialized area, compared with the north and the east part of China, west part of China, because that area is still agricultural area. So air pollution or water pollution, environment pollution is really one reason for the patient, have this kind of disease.
That's
Just
interesting. I've never
yeah,
heard that before. And are
sure.
there any other reasons?
And something deep, that's in China, if mama have such kind of baby, usually husband usually blame the mom, and also mother-in-law, husband's mama blame the daughter-in-law. Why you have such kind of baby? I told them that's 2 factors. One is external, one internal. External is environment pollution or something like. Internal, the sensitivity of the gene. So baby's gene come both from mom and dad. So dad cannot blame mom. Mom, the both things come from two people. So
So it can be
that's
so it
very
can be it can be external, i.e. pollution, and it
yeah.
can also be internal, and that can be genetic.
Yeah, because people ask me, the more we exposed in the pollution air, why just my baby? I have a problem. Why you? I have a daughter now working in the London. They ask me why your daughter have 2 years. I
Yeah.
told maybe that's a sensitive of the gene. That's true scientifically. That's the true reason. So
So is microtia, is it genetic? So it can be passed down?
just 5% of the patient in China, yes, from mom to daddy, You can find a similar kind of patient in the family, in mom and family or dad family. That's true.
That's interesting. I know we're short on time, Professor Guo. I just wanted to say if you could give one final message to all of the families around the world on this Microtia journey. Some of them are, they're caught in a predicament where they're trying to decide, should I have the surgery for my child? Should I not? I don't know what to do. Should I wait? What would your advice be to them?
First, it's not a big deal. It's a small surgery and, small deformity. Ear is not important as eyes and the nose, So that's not a big deal. If you want to do the surgery, it's a small surgery. It's not easy to do that, but the surgery is not big. So, mama needn't worry about it. But I found nowadays, because we have the very good result, more and more patients try, to do more and more parents to try to do the surgery for their Microtia baby, because when they have this after have the surgery, boys and girls enjoy the life. They become much happy compared to before the surgery. So that's I think it's nowadays really wanted to do it.
Yeah.
So wants to do it.
Yes. Okay. Professor Guo, I wanted to say a huge thank you for coming on today's show, for sharing your expertise and your knowledge. And if the listeners would like to get in touch with you, what would be the best way?
Yeah, I'm also happy to talk with you because my daughter now working in London, and I have the grandson. His name James. Is also in London.
Oh,
So
nice.
yeah, so I visit London, usually once a year. So I'm really happy to talk with you. If you need any help, I will try my best to help you and help other patients. I think a lot of these kind of patients in your country and around the world. If they need help, I'd like to give lectures and to tell them scientific knowledge. And even they want to find it to do the surgery. Even a lot of patients line up, but still I can try my best to help them.
Maybe when you're next in London, we can arrange a meeting, and so they can ask you questions directly. I'm happy to organise that. We can talk about that another time. Professor Guo, it has been an absolute pleasure. I have really enjoyed our conversation, and I know that the listeners will really appreciate your advice, your expertise. And again, it's, sharing knowledge, sharing stories is what this podcast is all about. And this is to help you guys to, navigate your Microtia journey by bringing on the experts like Professor Guo. And it's been a pleasure. So thank you very much. Enjoy the rest of your day, and we'll be in touch soon.
Well,
Thank you, Professor Guo.